Hello, and welcome to Cahnmann's Current Events Roundtable. Today, we have an outstanding guest that I invited, Dr. Adam Rubinstein, and we're going to be talking about opiates, all about opiate addictions and preventive measures. I think it's really important because there's so many people, so many kids that are dying from opiate drugs. I just want to read something that I think is important, and this is it. America is facing a growing epidemic. Prescription painkiller addiction is an equal opportunity disease affecting individuals of all ages, gender, races, and socioeconomic status. Each year for the last 11 years, the number of people battling this addiction has increased. Today, prescription painkiller addiction, also known as opiate dependence, affects millions of Americans. Sadly, it is often a common gateway to heroin and other drug addictions. While opiate prescription painkillers can be effective medicines, some people develop a dependence as an unexpected consequences. Over time, opiate prescription painkillers can alter the brain's chemistry by resetting the brain so that one feels that they need opiate prescription painkillers just to go through the day. Welcome, Adam. I'm so happy to have you.
It's an honor to be here.
Thank you. And, maybe you could tell a little bit about opiates. And in fact, one thing that I think is very important is that that people don't realize that addictions, it's a medical problem. It isn't something that, I decided I need a drug and that's what I'm going to do. Maybe it starts off like that. Kids at a party, maybe smoking marijuana, doing things that they, taking different types of drugs like cocaine or something like that. And it starts at a party, and then they start feeling good by doing it. But it isn't what we think it is. It happens to be a medical problem, and I need you to talk about that because I think our viewers, our audience, needs to know about that.
You're absolutely correct, Suzanne. You've obviously done your research. Most people do not know that. We call addiction a chronic relapsing brain disease, and that's addiction to any drug and even food. We can see changes in the brain in folks who have addictions to anything, including opioids like painkillers, Vicodin, Norco, and heroin. We can see them on a PET scan and a functional MRI scan, such that a doctor in another room has never met the patient, and they do a scan and they see abnormalities on that scan consistent with addiction. It's no different than seeing a fracture on an X-ray or seeing a brain tumor on a CAT scan. So this is a medical problem, and it has nothing to do with moral weakness or not being able to control yourself or pick yourself up by your bootstraps and handle stress. It's nothing about that. It's a medical condition just like diabetes, asthma, or heart disease, as you mentioned.
We were talking a little bit earlier, and I had mentioned to you that I was taking some medication, and I got a little bit dependent on the medication. And I finally, the doctor titrated me, and I was able to go down to 2 milligrams from 10. And I thought, oh my God, I became addicted. And you told me that is not addiction. It's a dependency, but it's not addiction. Maybe you can, maybe you could explain what's the difference between being dependent on something and being addicted.
Absolutely. And then if you don't mind, I'll add tolerance. That's the third leg of that stool. So dependence can be good or bad. If someone sees me in my office, by the way, I practice internal medicine. I'm also board certified in addiction medicine, so I'm seeing patients in my office for both problems in an integrated way.
And you're in?
I'm in Vernon Hills. I'm an independent solo practitioner in Vernon Hills, on staff at both the Advocate System, which is mainly Condell, and North Shore University Health System. I guess I should add, before we go on with our answer here, that I'm here on behalf of Soft Landing Recovery, which is a full-service addiction program. I'm likely to become their medical director here in Highland Park. They're opening a full-service facility for addiction in Highland Park. They're also opening one in Vernon Hills, where my office is. They already have them in Naperville and in Des Plaines.
You know, it's interesting you said Highland Park because you don't think of, oh, you know, addictions come from the bad neighborhood.
Right.
Kids that don't have a father, they're raised by maybe their grandparents or somebody, they're standing on corners all day, but it's Lake Forest, it's Kenilworth, it's Highland Park, it's all the above suburbs and the North Shore, which is affluent, and you wouldn't think, you know, these kids have everything. Why addiction? I would be euphoric just being, you know, being in this area and being, you know, they have everything. Why are they going to these substances?
Okay, so let's answer both questions, the addiction, dependence, tolerance question,
Sure.
and this question together.
Yes.
You're so right to connect them.
Yes.
So first of all, let's just define our terms, and then we'll get into what's happening in the suburbs.
Okay.
And just to quickly go to that issue so people understand it, there are probably more people dying of heroin overdose in Lake County in northern Illinois than in any other area in the entire country. We have an epidemic in the nation, and it's been an epidemic since 2009. It was labeled that in 2011, and more people are dying of addiction to anything than all car accidents put together, which is an amazing thing. So addiction itself is, well, let's start with dependence. You brought that up.
Right.
Dependence is this. You take a medication, in a good sense, it works for you. A cholesterol medicine I prescribe for someone, their cholesterol goes down. I prescribe a blood pressure medicine, like a beta blocker, and their blood pressure goes down. And they need to remain on the medicine for it to continue to work. That is a good dependence. A bad type of dependence is if you're using a drug, such as cocaine or Vicodin or Norco, which we're going to get into today, and basically you start taking it, and you realize that you need to continue to take it. Initially, you may take it and you feel a little bit like your brain is soothed, or you're removing yourself from the problems of reality, or you're getting high. But very quickly, you need to continue to take it, or you will go into withdrawal. These drugs that are causing these addictions are receptor-based. Now, when they get metabolized and fall off the receptors, the patient feels they will die unless they have more. And so the dependence in the bad sense is that they feel they must keep using, or they'll have withdrawal, similar to someone like you or a friend who takes any other medicine and it's receptor-based and they stop it. Like a beta blocker, if you go off a beta blocker, which is a good thing, helping you, you stop it suddenly, you'll also have withdrawal.
You say withdrawal. Can you explain what is withdrawal? Because a lot of people, the word is used, or they're withdrawing or what have you. What is withdrawal?
Okay, so just as addiction is a chronic medical condition, withdrawal is also a medical condition. Patients typically have the same symptoms, regardless of what it is they're withdrawing from, although there are some variants that we don't have to get into. So if someone's addicted to heroin, or Vicodin, or Norco, or fentanyl, all of which are opioids, and they go into withdrawal, they will have severe insomnia, they will be up all night, they'll have tremors, they'll turn white and be pale, they will have very dilated pupils, they'll have diarrhea, muscle aches and cramps, they'll feel like they're going to die, and they'll be extremely anxious. So their entire body is affected, and their mood and mind are affected. And they're really going to be craving immensely, feeling like they have to get another dose or another hit of whatever it is that they're addicted to, or we should say what they're dependent on at that moment, or they're going to really die. And so that's what drives the next step, which is addiction. Their behavior changes. So if I'm addicted to something, the definition of addiction has nothing to do with the fact that one goes into withdrawal when they stop it. Like I said, a beta blocker, which is a good thing for blood pressure, causes withdrawal when you stop it suddenly. That's not an addiction. Or stopping prednisone.
You may feel lethargic or tired,
Correct.
But you don't have the craving. I need it now.
Correct.
And
correct. That's exactly right.
Right.
And we were talking about people who take chronic prednisone before. If you stop prednisone suddenly after you've been on it a long time, there's many changes in your body in terms of your cortisol and your hormones that are very dangerous. So you have to wean down. Now, when someone is addicted, that's because their behavior has changed. If there's nothing else we get across today, it's that the behaviors of the individual is what defines the addiction. So someone who is lying, cheating, or stealing to get more of that drug, they are already going along the lines of addiction. If they're withdrawing from social circumstances when they used to like to be with the family at events or go to parties and now they're staying home, if they're hanging out with a different crowd, if they are basically craving and thinking about that drug all day long.
Right.
Maybe they're having problems in their job, or they lose their job, they're losing their emotional bonds and their connections to a spouse and family. Those broken bonds and those behaviors that are now destructive, yet they continue to use, define addiction.
And when they steal, I had a friend whose son had the same problem, and all of a sudden she couldn't find her car one day, and they said it was gotten stolen. Well, obviously it was never stolen. It was sold for the medication.
Exactly.
So they do things that, you know, they steal from their parents, all kinds of things.
Exactly right.
You know, and these are nice kids. These are kids that are grown up. They grow up in nice neighborhoods. They have good family values. And all of a sudden they get hooked on these drugs, and this is what happens.
Okay, so let's go along this line. That's exactly what happens now. The way I would say it is that they're people. They're people. They're not addicts. They're not anything other than people who have a medical disease. And unfortunately, this disease is stigmatized and shunned, and so they become like shadows in the dark corners. Doctors don't want to treat them, and the families don't need to talk about it with others because they're embarrassed, and that's what happens. Now, the reality is that that occurs because of our third term, which is tolerance. So what happens typically, by the way, you mentioned parties, that these days is a very, like it's not a common reason that people become addicted to opioids. The most common reason right now is because patients have an injury, they have pain, they have chronic pain for whatever reason, and their phhisicians prescribe them
that's what I was
large
gonna
amounts
ask.
of opioids. So it's really the doctors like me, and I take responsibility, although I'm trying, of course I try to be responsible. But the reality is that you
like
go to the
Vicodin, Percocet,
Norco.
OxyContin.
Right.
These are, the
Right.
drugs that
And so, exactly.
they're having,
exactly.
like maybe they had back surgery.
Exactly.
And they're in a lot of pain. So they take these drugs, and it makes them feel better, and then they can't get off of it. Is that what you're saying?
Well, there's two ways it goes. One way is if they have a strong hereditary proponent where they are highly vulnerable to this. About 50 to 70% of addiction to opioids, like pain pills and heroin, is actually hereditary. No different than diabetes. So if you have two identical twins and they're separated at birth and they never see each other again, raised in different states, if one develops type 2 diabetes, the other has a 70% chance of getting it, which is why every doctor asks whether or not you have a family member with diabetes. With addiction to heroin and pain pills, it's a range of 50 to 70%, and in my practice, it's 70%. So the fact is that you may have a preponderance in your genes that says as soon as you contact that drug, your brain loves it, and you decide you're never going to not get it, and that is one way it happens.
Yeah, is there a test or something that doctors, before they give out these drugs, is there a test or something that they could ask if they ever got addicted to, say, sleeping pills? People take sleeping pills and become addicted. Isn't there some kind of a reference that they can, when they're taking to find out, do you have heart failure in your family, and I always fill out these forms, and is there any kind of reference that they can look at before they prescribe pills like this?
I just have to say I love your questions. Your questions are right on. So the answer is yes, but it doesn't happen. So the word test implies a blood test or a genetic test. The answer is no, we don't have that yet. We will eventually, but I'm not actually holding my breath and worrying about it, because that's such a Western medicine idea. We have to have some technology that saves the day, and always that doesn't save the day. What we need to do is talk to our patients. The test is in the communication. If I ask a patient, does anyone in your family have a history of alcohol addiction? Has anyone had a history of marijuana addiction? Has anyone had a history of pain pill or heroin addiction? And in addition, there's a whole other side to that story. Has anyone had, the word we use is nervous breakdown. That's not really a term that doctors use, but that's what patients understand, and been admitted to a psychiatric hospital. Serious depression, bipolar disorder, PTSD, anxiety. In fact, the majority of patients that I see have a coexisting mental health problem. We call it dual diagnosis. And reality is that they were probably having that mental health condition from the time they were born.